All right, welcome in everybody. Thanks for joining us. Today we're sitting down with Syed, CEO and founder of SRS Web Solutions. Welcome in.
Thank you for having me, Zack.
Absolutely. So I just wanted to jump in. Recently you wrote an article in Forbes about patients delaying care due to healthcare costs. Can you break down a little bit about what's happening in the healthcare system?
Sure. Yeah, that's a great question. One thing that what we have seen is that right now, millions of Americans are forced to gamble with their health. They're delaying care, not because they want to delay the care, but because the cost feels like a financial nightmare. I experienced this firsthand with my son. He's 13 now, but at that time he was 9 when he complained of a sudden chest pain. And as a parent, your mind races. Is this just a muscle spasm or something more serious? But instead of rushing him to the emergency, to the hospital, I hesitated, worried about the medical bill expenses that could follow. Even though I pay $1,000 or more for family insurance, the fear of hidden cost still froze me at that moment. Thankfully, it turned out to be something very minor, but the hesitation at that moment that literally shook me to core. No parent should ever be forced to weigh their child's health against financial uncertainty. That's what I believe. Unfortunately, my experience isn't very unique. It reflects the national crisis that we have today. Over 1 in 3 Americans, they delay or skip the treatment today because of this financial fear, because of this unknown financial burden that could come to them. Every day, patients hesitate to seek care not because they simply don't care, but because of this fear of unknown. Even with insurance, people who have insurance, and majority of them do, there's a fear of high deductibles. There's a lot of unknowns, limited coverage, complex billing processes that makes them anxious and vulnerable. And doctors and providers are not too different, they're stuck in the same broken system that we have today. Constantly, the doctors and the office staff and hospitals, they have to constantly struggle to explain the unpredictable cost to the patients. As a result, many decline, the treatment. So in my Forbes article, I highlighted how these issues are specifically hitting the dental and dermatologists. They're getting hit pretty hard with this. Their treatment acceptance is going down, not because patients don't care, but because they're unsure how to pay for it. But the good news is that, there are leaders in the tech community and the healthcare community. They're coming together to find solutions to these problems by offering flexible payment plans, trying to do more and more, taking burden on themselves to find more about how much of insurance is covering and how much out-of-pocket is there. But there's still a lot of gap there. So the stakes are clear. Every delayed decision puts patient at risk and providers' livelihood along with it, right? I think it's time to replace financial fear with financial clarity, because healthcare should never be a gamble. It should always be a promise. That's what I wanted to say, to your question. That was a good question. Thank you.
Yeah, absolutely. And do you feel like patients, when they're delaying care, they're really trying to weigh whether or not the health issue is serious enough to take them to the doctor, or whether they can, self-care at home because of that uncertainty?
They do try DIY a lot of times, right? But I don't think it's a good idea with your kids, with yourself. A lot of times, I'm culprit to myself where I think that, it's nothing, it's a gas issue. But if there's something going on within your body, you're not a doctor to get out what's happening. It's always better to run to, the experts for this stuff. Yeah.
Okay, great. And when it comes to the healthcare office, what do you feel like are some of the biggest pain points within the healthcare office, and probably a little bit more specifically, the front desk?
When you say front desk, front office, I feel really bad for them, because I know that front office staff are under immense pressure. They are the first line of communication with patients, and right now they're overwhelmed, not just by volume, but by complexity of the system that they work within. Today's front office teams are juggling nonstop. You have to think about how they're juggling between phone calls, manual insurance verifications they have to do to get clarity to the patients. They have to schedule appointments, reschedule appointments, billing questions, upset patients. And while trying to maintain all of this, you got to make sure that you have your smile on your face, right? The problem is they're doing this with outdated and broken systems that don't talk to each other. There are limited tools. There is little automation. So when the patients, are confused and the waiting times are high and they want to get more clarity, they usually take the brunt of the patients. They usually are the ones in the front lines there. For example, I was talking to one of the office manager a week ago, and I asked her how things are going. What do you guys think? Is it improving? She said that, most of my day is spent firefighting, explaining unclear bills, calming frustrated patients, and trying to get through insurance companies, trying to get on. Basically, you got to call, right? Sometimes you got to call. They put you on the hold. You're just waiting for the insurance companies to answer and help them to clarify what's covered, what's not covered. And it's just not anecdotal. A recent MGMA survey, MGMA is a big organization, found that over 70% of practices list front office burnout as a top operational concern. 70% is huge. So to fix this, we need to take the pressure off of the front office. And that starts with automation and clarity. There are multiple tools nowadays in the market that you can provide assistance to your front office by having an AI assistant to answer calls, schedule appointments. Zaha is one of them, as you may know. You need to digitize all the forms for them. So you got to look at what the front office is busy, right? If they're missing calls and they're busy, provide an assistant. If they're having problem completing and getting the forms, there are too many mistakes happening with forms. You got to make sure that all your forms are digitized so the patients, before they come into the office, they're able to complete the forms. And enabling simple tools like simple payment tools that will automatically upload the EOB or upload the transactions into your EMR system. It takes a lot of burden off of their shoulders. And these are not just tech tools, right? These are not just good techie stuff, but these are lifelines for the front office which they depend on. So when we simplify operations, we don't just reduce stress on staff, but we also create better experiences for our patients and healthier bottom line.
So that's really great. One question that comes to mind when I think about that is the staff ever weighing the options of those tools in terms of if they implement these tools, they'll feel like they don't have anything to do because all of the work is being taken up by the tools?
No, we think that way. But if you talk to the front office staff, they have so much stuff. Usually, they're not able to handle like there are 5-6 things at a time going on, and the more assistance you provide, and you need people to also manage these tools. They're not like they're going to do everything for you, right? So there's a lot beyond these tools.
Great, appreciate it. And Samad, what are patients really asking for when it comes to the healthcare system today?
Good question. Actually, I was discussing this with one of my doctor friend, and today patients are asking for something deeper than just good clinical care. What they're asking for is convenience and clarity with good clinical care. They want a healthcare experience that is simple, transparent, and human-centered. They don't want to feel like they're just another appointment, right? And most patients are frustrated today. I'll tell you why. And, they're dealing with long wait times. The paperwork is confusing too much. There's no clarity on insurance that we talked about. Surprise bills, disconnected communication. They don't want to chase information or sit on hold for like 15 minutes just to get answers. Like you and me, they want to feel controlled. They want to feel in control and control of their time, money, control of their health. And as you and I would want for ourselves, they want clear expectations, real conversations, and to be treated as people. As I said, don't treat me as another appointment. Across hundreds of practices, we have seen the same shift. Patients now want ease as they get from apps like Amazon, like you go, you order and it comes next day. Uber, you sit on your phone, you can, order a car. You can just drive wherever you want. You just put the address and it takes you there. That's the level of customer support service and that they're looking for. That's the ease. That's the ease that they're looking for. They want to schedule online. They want to get reminders before the appointment time. They want to know their cost up front and just let me pay for my phone, right? So in fact, there's a study, there was a survey that was done and said that 75% of patients said they would switch the providers if they have good digital experience. If a provider A and provider B, good digital experience, 75% of them said, I'll go for ease and convenience, knowing that there's the same clinical care that's happening. So to meet these expectations, practices have to start thinking beyond clinical care and start, delivering service like this major consumer brands. That means transparent pricing, flexible payments, clear upfront information, frictionless digital intake of patients. Because when you give patients convenience and clarity, and you don't just make things, and you just don't make things easier. You build trust with them, improve outcomes, and you earn loyalty with them. That's what happens.
Absolutely. And so what it sounds like is that tools can help both the office and the admins, as well as that transitions and flows into the patient experience as well.
Yeah. So if you think from the perspective of the patient, their experience in your practice, they're always comparing you with like, oh, I went to McDonald's. What was the service there like, right? They have, for order intake now, they have big TVs. You can just go enter your information, what you want, and 5 minutes, you get it. You take it, you leave, or you sit and you eat. Now, I know that many practices are like, oh, that they're big brands, they have big chains, but the tools are available for them too. Like, it's not just like, now big brands can only afford the tools, but there are tools available for them at subscription cost, which they can implement in their office and give similar experience to their patients.
And how would you say that your company SRS is addressing these things differently than other software companies out there?
So I'll tell you that SRS is not in the business of selling software. We are in the business of solving problems that slow down front offices and frustrate patients. What makes us different is that we build our product with empathy, grounded in day-to-day reality of practices, not in a vacuum. Most traditional softwares are built by people who never worked at the practice. It looks good on the paper, but it creates a lot of friction in the workflows. At SRS, we start by listening to our front office staff, providers, teams that work with them, vendors, and also we listen to the patients, and then build solutions around and figure out what they truly need is speed, simplicity, transparency, all that stuff is included in our software. For example, I like to talk to the doctors and front office staff, and especially in the DFW area, I just go visit them. I asked, one of our clients, like, what do you like about mConsent? She's like, oh, before we used to miss calls over the weekend. And we used to miss at least, 5-7 calls over the weekend. We didn't realize that were actually appointments. Now we started seeing 3 to 4 more appointments while we are with our families on the weekend enjoying. And people are able to call in, and our AI assistant answers it and schedules appointments. So that gives us immense pleasure from the work that we're doing. Another patient of mine told, like, this is interesting because what he said is that I used to send this mail invoices to my patients to get the payments. I never got it. Then when we started using you guys, we sent out a text message, and after 5 minutes, I got a call from my patient saying that, hey, did you get my payment? I just made it. Like, I sent a text message 5 minutes ago, and he said that he's in a parking lot trying to get in the car. And when he got the text message, he sat in the car right away and made a $1,200 payment. And now he's calling and confirming if I got it. That's beautiful, isn't it? So you made the payments easier. You help us to pick up the calls, and insurance concierge is powerful. Like, you take away all the time away from basically somebody who's sitting on the phone and being busy, right? Sitting on the phone and trying to get the insurance information, getting on the portals and all that stuff. We provide the insurance agent to this office, and now this person can do a lot more than they were just sitting on the phone and just trying to get insurances done. So that's how we help. We bring this all together, digital intake, automated insurance checks, AI receptionist, reminders for treatment plan, flexible payment option. It's one cohesive platform that actually saves time, reduces no-shows, and improves your case acceptance. So not trying to sell, but our mission is simple but powerful. Make life easier for the front office staff and the providers, and making care more accessible for the patients. We're not we're not here to add more software on you, right? We are here to eliminate the roadblocks and redefine how health practices can operate.
And I think from the outside looking in, if you think about it, sometimes it seems like it's just software for the office. But if you take a look back at something like Zaha, you were just talking about, something I connect with is that getting a patient scheduled over the weekend while you're home with your family not only helps the office increase revenue and continue to grow, but also the patient is less stressed because now they're not calling another office. They're not forgotten about. They don't forget about it and maybe not schedule for 4 or 5 more months.
Yeah, both online scheduling and having an AI receptionist is a big convenience for the patients. So they don't have to wait for 8 o'clock in the morning on Monday to make a call, right? So that's important. Yeah, thank you.
Absolutely. So Samad, I know you've worked with small clinics and large DSOs. What's some of the common mistakes you see when it comes to technology adoption?
One of the common mistakes that I see practices and the staff have done, we work with 2,500 plus practices, and we see this day in and day out. And one thing that I saw, one of the biggest mistakes that they make is they treat technology as a one-time install. It's not a one-time install solution, but it requires a team buy-in, it requires training, and it requires habit change at the practice itself. Even great software fails when it's not adopted properly. too often practices, install a new platform, but they skip the onboarding process, they skip the training, they skip leadership alignment, why this is important. Without that, the software becomes a shelfware. Wasted investment, wasted time, everybody's frustrated. We saw this in an office in Chicago where we rolled out a scheduling platform. The tool was fantastic, but the staff weren't using, the way it's supposed to use. You got to log in, no training. They don't know how and they don't know why. Why do we have the software? How do we do this? Because no training, skip onboarding and all that stuff. And 2 months later, the doctor was ready to cancel. Instead, what we did is that we figured out that, okay, this is the problem where the leadership was not aligned. They don't know how and they don't know why. So we did a 2-week intense training with the staff. Once the training was done, they understood the hows and whys of why do they have the software in place, first of all, how it helps them. And what we saw is that after 2 to 3 weeks, they saw improvement in the show rate of the patients, 10% improvement in the show rate. So the software wasn't broken, the adoption was broken. So that's a huge mistake that practices usually make. You have to understand is that technology is just half of the battle. The other half is, leadership training and proper follow through. If your team doesn't understand why, they will never consistently use the how. So adoption isn't just about the features, it's about, the culture that you're trying to change.
That's great. That's great. So if you had to say that there's one strong next step after putting a tool in your office to adopt it, what would that next step be? What would you tell the doctor to do next?
The first thing that before even signing up for any software, the doctor should sit down with the staff and explain why. The why is more important than, oh, we're doing the software, right? So because usually the doctor or the office managers, they come on the demos, they sit on the presentations, they're convinced that this is the right thing for them. But the same information is not there with the same knowledge base is missing with the staff. And what that does is that they're not fully bought into this idea of using another software because it's not, nobody wants to use 5 different softwares, right? Of course. It's not this is not another software, but we're trying to solve a certain issue using this, using this platform. So I think that's the first big step that the doctor should, or whoever the ownership or the leadership should do with their staff.
Awesome. And if you had one thing that you could tell healthcare leaders today, what would that be?
That's a good one. One thing, yeah. I would say don't let complexity win in your practice. Build things around simplicity, and this should be for both your staff and for your patients. The healthcare system is already complex, right? It is complex. We know it's complex, but your practice doesn't have to be complex. And the more you simplify processes, you streamline your communication, you streamline your scheduling, remove friction from payments, remove friction from acceptance of treatment, the faster you will grow, the better care you will deliver. Because you need convenience, you need clarity, all that stuff needs to be in place. So we saw this with a client who doubled the collections in their office. I'm going to go to the same office where we installed, the text to pay system where instead of mailing the invoices, we were able to install the text messaging system. And what they did is that they streamlined the payments for the patients, bringing convenience to the patients. Who checks mail for paying invoices these days, right? So what they saw was the doubling the collections. There's no marketing dollars spent here, just simply streamlining, making it convenient for the patients, and which results in improvement in the bottom line. So automation without ads, what ads couldn't do it, the automation was able to do it, right? So, and you could feel the difference. The staff is happy, less stressed, and the patients stop, hesitating because they know it's clear what they need to pay.
That's great. That's great. Well, listen, Samad, it's been really good sitting down with you today. I think I got a lot of great information, and hopefully the people viewing this also got some great information out of this as well.
Thank you.
Where can people connect with you if they wanted to connect?
So I'm on LinkedIn. If you look for me, Samad Syed on LinkedIn, I'm pretty active on LinkedIn. And also, you could go to our website, mConsent.net, and connect with us on that, or srswebsolutions.com. All right, fantastic. Well, thanks again, everyone, for tuning in. My name's Zack Lopez. This is Samad Syed. And thank you.
We appreciate you.
Thanks for having me, Zach.
Absolutely.